Today we are on the campus of the University of Georgia in Athens, speaking with Dr. Brenda Fitzgerald, our State Public Health Commissioner. You have spoken a lot about the importance of telemedicine to Georgia. For those who don't know what telemedicine is, what is it and why is it important to the future of the state?
Thank you for the question, because telemedicine is very important to public health. Telemedicine is the ability for the patient and the doctor to be in separate places. For that to happen, we need cameras and we need medical equipment that can transfer information from where the patient is located to where the doctor is so the decision can be made.
Telemedicine sounds like it might be a rural medicine idea. Is it more than a rural medicine idea?
Oh, it's absolutely more than a rural medicine idea. Certainly in Georgia, because we all know that Georgia's a large state with a lot of rural areas. What you may not know is that we have a doctor shortage in Georgia, especially we have a doctor shortage in rural Georgia. I am aware of this because in public health we have been looking at infant mortality. It's one of our main issues. And we did an evaluation of the state where we looked at where the babies with prematurity and infant mortality were coming from. We looked at the state in mile square grids, and we identified 6 different areas that were urban, by the way, that had high cases of infant mortality. And then we identified on the west side of the state a huge area with not very many people, but a really disproportionate share of prematurity. And there were absolutely no OBs in that entire area. So we know that the distribution of doctors, the accessibility of doctors to the rural population is especially important. Telemedicine, though, is not only for the rural parts. If you need, for example, genetics testing, you can, from any place in the state, if you have a telemedicine network, have a genetics clinic where a child born in Valdosta can see the best specialist at Emory about genetic information. So yes, it's rural for basic health and complicated health, but it's also urban for the specialization that we need in certain medical conditions.
We have often heard over the years a conversation of 2 Georgias, that there was essentially a North Georgia, Atlanta-centric kind of economy and environment, and then there was everywhere else in the state. It sounds like you're describing something similar with a medical perspective to it.
In a lot of ways, that's true. But the interesting thing is that a lot of things are not just dependent on where you live. Like, for example, one of the incidence of infant mortality in the state had been about 8.3. When we did our study in Valdosta, which is not really a rural area, their incidence of infant mortality was 17. And in Athens, where we certainly have a very sophisticated medical system, we had one of the highest incidences of the state. If memory serves, it was about 15. So it was almost twice what the state average was. So yes, there are 2 Georgias as far as rural and urban, but for medical problems, certainly distribution of doctors is is urban and rural, but medical problems are often not.
What is the greatest public health challenge that the state faces? And I'll add a second part to that question. What is the greatest challenge that you and your people face creating a public health awareness? And in fact, you have created the Department of Public Health here in Georgia.
The greatest problem we face is obesity. Because obesity is an indicator that there may be a lack of health. It leads to diabetes, hypertension, heart disease, certain cancers, all those things that are the chief killers of people in Georgia. And in Georgia, our youngest citizens have the 2nd highest obesity rate in the nation. The number 1 challenge that we face is obesity. And we are delighted that Governor Deal has chosen childhood obesity as his number 1 health initiative, and we are delighted that we have been able to participate in bringing together the people of Georgia to come up with a plan to initiate and to address this issue.
And then what then is the greatest challenge that you and your team have faced in creating a Department of Public Health and creating the awareness that goes with being a department?
I think the greatest issue is that public health for so long had been buried in a super agency. So it was very difficult to know what public health did. And what public health is, we are the state's asset. We are the state's asset certainly as a safety net for healthcare, but we are the state's asset because we have the information, we have the data, and we hire the people to analyze the data. So the greatest challenge for us is to let people know that we have the data and we will share the data with you, and you can use that information to change the health outcomes of all Georgians.
Dr. Brenda Fitzgerald, thank you for speaking with the Georgia Public Policy Foundation.
Thank you.